Good morning, everyone. My name is Veronica Judy Cecil. I'm Senior Deputy Commissioner for the Kentucky Department for Medicaid Services. Welcome to our September monthly stakeholder meeting. I know we might just give it just another minute as folks are coming on, but we do appreciate you being here, and we'll get started in just a minute. Okay, I think it has slowed down. So again, my name is Veronica Judy Cecil, Senior Deputy Commissioner for Medicaid. Welcome to our September monthly stakeholder meeting. We appreciate you taking the time out of your day to be with us. And even for those folks that can't join us live, we will record this and post it so that folks can go and check it out at their convenience. So it will get recorded and put on our Unwinding website, as well as the slides that are being utilized today. It is a small group, so if you have questions, we didn't receive any prior to the meeting, but if you have a question, please feel free to put that in the chat. I am going to share my screen just as the level setting, just a reminder to folks, because sometimes we do have new attendees to the stakeholder meeting. You know, what we're talking about is unwinding the public health emergency on March 31st, the continuous enrollment coverage that was mandated for states to keep folks on Medicaid during the public health emergency. That continuous enrollment ended, and we were required to restart redeterminations or renewals. Those words are used interchangeably in Medicaid, but what it means is that there is a requirement that we have to make sure that everyone is still eligible every 12 months. So we've taken the cases across during the public health emergency. We've allocated them across the unwinding period, which started in April with initiating May renewals, and goes through April of 2024. Another thing to note, and we'll talk about flexibilities a little later, but we did implement a lot of flexibilities during the public health emergency. Those flexibilities ended on May 11th with the end of the public health emergency. We always like to give a snapshot of our enrollment, and you will note starting in May, there was a decline in enrollment. That's because we did start with anyone with a May 31st, 2023 renewal date. We did start terminating individuals who either were determined ineligible or did not respond to a notice that for us to be able to make that determination. That continues to go down, and not highly unexpected, because we did know that during those 3 years of continuous enrollment, folks were becoming ineligible due to various reasons, but we never terminated them because of continuous enrollment. So we already did a snapshot and did estimate losing approximately 230,000 folks over the 12 months of unwinding. So this kind of decline in enrollment that we're seeing is somewhat expected. It doesn't mean that we're not reviewing those terminations just to ensure that people are being properly terminated, but we'll talk about some of those efforts. So we did not have in the last stakeholder meeting some of the data. We do submit a monthly report to CMS. It's due the 8th of every month, and it includes the reporting period for the month before. So this is data from our CMS monthly report for the July reporting period, July 1 through July 31st. So this includes anyone who had a July 31st renewal date. And as you can see, there was 54,975 beneficiaries, so individuals in Medicaid who had that July 31st renewal date. Of those, we were able to approve 27,044 prior to that July 31st date, and we did terminate 20,344. You see a bucket there that is of individuals pending, and there's 7,587 that we reported were pending for July renewal. A pending case is one in which we have either extended the renewal, and we'll talk about extensions soon. But if we extended the renewal to another month, or they had documents pending and the state did not take actions on those documents, then that individual case gets then moved and not terminated and becomes a pending task for the state to process that paperwork. Those numbers, everything is really a snapshot. This is the snapshot of the report we filed for this reporting period. We'll report on reinstatements shortly, but what that means is as we go through cases that have been terminated and people do respond, they could potentially then be approved. And as we work through the pending cases, they could be put in either bucket. They could either be put in an approval bucket or a terminated bucket. So just to go through the data for the August renewals. So again, the reporting period for this is August 1st through 31st. That means individuals who had an August 31st renewal date. The initial count for that was 54,344. As part of our unwinding report, we did report that 28,296 were approved by that August 31st date. 20,344 were terminated. And then you'll see again that pending bucket, 7,386 crossed over that August 31st date and have been either extended because their population were extending or they have documents pending review. So I talked about reinstatements during the unwinding. As part of one of our flexibilities that we have implemented is a 90-day reinstatement period. What that means is that if somebody was terminated because they did not respond to a notice, what they can do within that 90 days post termination is complete whatever verification or documentation request. And if they do that, we can reinstate them back to the termination date within that 90-day period. They don't have to request that. It's an automatic thing if that happens within the 90-day period. So as you can see, we are tracking those reinstatements. And for May, that 90-day period has closed, but we did have 5,618 reinstatements. For June renewals, we've had 5,253. For July renewals, we have 2,794. And then, of course, August renewals are our most recent, but we already have reinstated 1,155 of those cases. We always try to let stakeholders know what we're focused on, and these really haven't shifted very much because they're really priorities for us. That includes making sure that households who have children, if they receive a notice, just that make sure they respond. Sometimes the child federal poverty level limit is higher. The percentage is higher than what an adult's is. And so just making sure that if there is income verification that's needed for the child's eligibility as well as the adult, that they send that in so that we can make a determination. I think it's always better if the state can make that actual determination of eligibility rather than somebody be terminated because they didn't respond to a notice. So responding to notices, ensuring that if a household involves a child to make sure to send it regardless. And then just following up on that 90-day period, we really have been trying to do a lot of outreach around educating members about the process to make that request, to reach out post-termination and submit that information so that we can make a determination on the case. I will say, so there's been, this was not necessarily processed prior to the public health emergency. So this is fairly new for unwinding. And there's education going on both sides for our DCBS workers and others that assist members with redeterminations or renewals. Prior to the public health emergency, it was really just a reapplication. But during unwinding, because of the flexibility we have, just making sure that everyone understands that it's not, you don't have to go through a reapplication process. It's just submitting the documentation so that we can reopen and process them to make the determination either way, either eligible or ineligible. We're continuing to work on that, but just wanted to kind of flag that for folks that we do hear that, when a member reaches out after termination, they're being asked to reapply. And that's kind of an education that's going on. The reapplication process is not as necessarily onerous as it would be if you were just applying new. The application should pre-populate itself with all the information we have available. The member would still need to submit the information that was requested in the original notice, but we are trying to work through those so that it's not a barrier to members contacting us post-termination to go through that reconsideration period. If they hear we apply, that they might not want to move forward in the process, and we recognize that. We hope we have providers participating in the stakeholder meeting, and so if there are new ones, just wanted to flag that we do have flyers and other materials on our website available to providers. The purpose of these are really just to help your communication with the patients walking in who are Medicaid members going through a renewal. The more we can outreach and provide this information where our members are, and they are obviously in a lot of provider offices in our different provider types: hospitals, federally qualified health centers, rural health centers, primary care offices, pediatricians, just a lot of providers across the state. This is one way for us to reach the member. So we do ask providers to at least maybe post a flyer somewhere that the member might see it when they come in, and help us with that campaign to alert them that redeterminations have started, and they need to check to see when there's notices coming out for them. And also for providers that are 1915C waiver providers, which are the providers for the 6 waivers that assist developmentally and intellectually disabled individuals, as well as our elderly population. We have specific provider information for them. It includes how they can access a portal, which I'll show here in just a few slides. But it also has information. We're trying to keep it updated on Appendix K, which is the vehicle in which we were able to implement flexibility specific to the 1915C waivers. We're trying to keep those frequently asked questions updated as things change. And so that's a great way for those providers to stay in touch. And also just reminding everyone who assists a member through a renewal, whether it's a provider, a connector, maybe a community-based organization, that there are multiple ways in which a member can respond to a renewal. Is similar if somebody new was going to file an application. So forms can be completed and returned by fax or mail. They can log into a self-service portal on Connect. We have tried to encourage members to create that Connect account. It's not a setting that everyone feels comfortable in, and we recognize that. But for those who do, we do recommend it, and because it is an easier way to respond to notices, to communicate, to upload documents. And so we do recommend that members who don't have one think about creating one. They can also call a connector or the DCBS office, or they could, in the communities, we have connectors and insurance agents, as well as DCBS local offices that can assist a member navigating the renewal process. For providers that are on our stakeholder call, just a reminder that Kentucky Health Net does display the redetermination date. So if you're checking eligibility, which most providers do within their routine to make sure the member's eligible, if you see a redetermination date that is that month or the next month, or even just providing the member, since you're looking at it anyway, giving them an idea when their redetermination date is, would be very helpful. If it is the current month, and if it's the next month is approaching, then the member should have received a notice. And so if they haven't, if they believe they've not been contacted, then we do recommend that they reach out so that we can get them engaged in that redetermination process. Not every member has a redetermination date. And the reason for that is some members' eligibility comes from some set category. For example, SSI members, Social Security income members, their eligibility is determined by the Social Security Administration, and they will send us a file to let us know whether they're eligible or not. That's what determines their eligibility, not an annual renewal. Some SSI members who are also in long-term care, or who may be in one of those 1915C waivers we talked about, they would have a renewal because we are required to also determine their level of care on an annual basis. So that can cause some confusion, but understand that if somebody is just active Social Security, they would not have a redetermination date. For those providers that are our long-term care or 1915C providers who use the Kentucky Level of Care System clocks, there is a way to pull a report about their members or their patients going through a renewal and what that date is. So those members can follow the directions. This is contained in the information that I showed on a previous slide, where they can go and pull this information that will walk you through how to do it. We do encourage those providers to pull those reports so they can anticipate the caseload of patients going through those renewals. If a provider sees a large caseload approaching, we do encourage them to reach out to us so that we can see what can be done to support those members and support those facilities as they go through the redetermination process. In talking about Medicaid, but we also want to talk about the qualified health plans on Connect. And the reason for that is because we do know that some of our members are no longer going to be eligible due to income. They are above the federal poverty level limits for Medicaid eligibility. So it's also critically important, though, that they don't lose coverage or access to healthcare coverage. So as part of our unwinding, we're just reminding folks and trying to support members who lose Medicaid eligibility but qualify for a qualified health plan as well as an advanced premium tax credit. APTC is what makes those qualified health plans more affordable. In some cases, someone may have no premium or may have a very low premium as a result of APTC. So we're tracking members that are moving from Medicaid to qualified health plans, encouraging them to choose that plan and pay that premium, which is what's required for you to have coverage. Unlike Medicaid, qualified health plan coverage needs action. In Medicaid, if you apply, you're determined eligible, then you can choose a managed care organization, or if not, then one will be provided to you, assigned to you. In qualified health plan, you have to go choose the plan as well as make that premium for coverage to start. So this is our, again, monitoring of the qualified health plan enrollment. And as you can see, kind of as the Medicaid graph shows enrollment going down, the qualified health plan enrollment shows the graph going up. And that's good news because people are losing complete coverage, and we're happy to see that and continue to track that. So now I just want to shift a little bit and talk about, I mentioned there were a lot of flexibilities we implemented during the public health emergency. We've also implemented a great number for unwinding the public health emergency, and in particularly focused on the renewal process and the redetermination process. And some of this has allowed us to increase the number of individuals that we can passively renew at the beginning of the month so that they don't have to take any action. We're able to go out and either verify income, or perhaps they fall into a category that we can implement a flexibility to passively renew them without a notice for additional information. So that's meant to increase that passive renewal rate. And it's also meant to decrease the burden on our members going through the renewal process. These are flexibilities that CMS has given to states, and Kentucky has elected. Right now, there's a state strategy June 2023 list from the Centers for Medicare and Medicaid Services. We have elected currently 19 of the 23 strategies that have been offered to states. There's a couple that don't apply to Kentucky, and there's a couple that we're considering right now as to whether or not it makes sense to implement in Kentucky. So these are some of those flexibilities that are part of that state strategy list. Just to note a few of them, a couple that help us with the passive renewal process include being able to renew eligibility for individuals with income at or below 100% federal poverty level with no data returned. So what happens is we go out and ping, and sometimes the federal hub does not return information or doesn't return information in a timely manner. So this gives us the flexibility that if someone was previously determined based on verified information that's in this income at or below 100% federal poverty level, we have the ability to go ahead and passively renew that individual. One for non-MAGI, and MAGI is the Medicaid adjusted gross income. That's how we do folks that are enrolled in Medicaid based on their income. For those that are non-MAGI, and this includes a lot of our long-term care and 1915C waiver members, they have to do a resource or asset test in addition. We do have some flexibilities for that population as well, and we have been able to waive that asset test for our non-MAGI beneficiaries. I want to note that sometimes that doesn't mean that the non-MAGI beneficiary doesn't have to respond to a notice, because there could be additional information that is necessary for that redetermination. So it's not a blanket waiver of having to do something active for their case. But if the asset test is the reason that eligibility is being held up, then we can just go ahead and renew. A couple of other things. I mentioned the 90-day reconsideration period already, but a new flexibility we've implemented that our members might start to see is the permitting managed care plans to aid enrollees in completing and submitting Medicaid renewal forms. CMS is allowing managed care plans to not only do outreach to members, but also help them with completing those renewal forms. This is a great way that we can sort of expand on those folks that can directly assist a member. The MCO does have limitations on what they can do. They cannot help them choose a managed care plan. They cannot sign a document if a document needs signature, but they can certainly walk through, and if it's a virtual conversation, even show the slides on what the screenshots look like and help walk that member through those documents. They can help them understand what information the state's asking for, including, income verification or additional documents that might be requested for us to make that redetermination. So this is a fairly new flexibility that we're implementing, and you may see that managed care plans are starting to be a little more proactive around this flexibility. I do want to note, I mentioned Appendix K for our 1915C waivers. Those flexibilities were coming to an end on November 11th. However, we are currently in conversations with CMS about how do we extend some of those flexibilities. There will be a stakeholder meeting specific to Appendix K in the very near future. So we will make sure folks know when that's going to be and give them opportunities for that. I know there's a lot of questions and concerns from our 1915C waiver providers and members about what's going to happen, and we're trying to get that information out as soon as we can. So just a reminder, our website has a lot of resources on it. It has the CMS monthly reports that we submit. As soon as we submit it by the 8th of the month, we generally have it up on the website at least sometime that following week. We're constantly adding additional flyers and other resources but are open that if you're a stakeholder and need some particular special type of communication for the members that you work with, please reach out to us. We're happy to tweak as needed based on the situation. And we've done that several times over the course of unwinding, and we'll be happy to continue to do that. And just always a reminder that, we are on social media, Facebook, Twitter, or Instagram. You don't have to choose all three. If you can maybe follow or like one of them, we think it's a great way for stakeholders to stay in touch for those immediate communications that we need to make to folks. We do, notices about stakeholder meetings, scams, any changes in guidance that we receive. We generally do try to send out communications through social media first, because it's the quickest and easiest way to do that. About our stakeholder meetings. You're here today, and we appreciate that. They'll continue throughout the unwinding period. So just add that to your calendar, or if you're unable, maybe go add it to the calendar to go check a couple of days post stakeholder meeting for those slides and recording. And then just a reminder to providers, you do have access to a lot of information through the Kentucky Level of Care System clocks and through Kentucky Health Net to assist members. And now we will open it up for questions. I'm going to stop sharing and check the chat, and let's see where we are. So the number of terminations on your slides listed as 20,344 for both July and August. Well, yes. Okay. Thank you, Helen, for noting that. Apologies for that. We use the slide as the base, as the template. So our apologies. We'll get that fixed and make sure that is updated. As Helen notes, the terminations for August was 18,662. So thanks again for noting that. Do we have any other questions? We'll just give it a moment to allow you to add that to the chat. Well, as I'm not seeing any, then again, we do appreciate you taking the time. We appreciate everyone being part of our collective effort to help members navigate the renewal process, and see you next month.